record. Welcome everybody. It's the Tuesday, December 17th, 2019 ABH meeting. We have a quorum. We're in room 119 at Town Hall. The first order of business is approval of minutes from September 17th, 2019. Anybody?
No motion to approve.
And okay, all approved. Okay, thank you. Two other pieces of business related to that is the schedule for 2020. So if we do the third Tuesday of the quarter. So if we do that, we're looking at for 2020 in March would be St. Patrick's Day. I don't think anybody wants to do that, probably, right? How about the 24th, which is the week after? So for March, we'll do, and I'll send this all out via email. We'll do the 24th at 7 p.m. here.
Is that, does it run into Easter time? When is Easter time?
Easter is not until...
Because I know there's a week off where I work for the school.
Yes.
I don't know what week that is.
Easter Sunday is not until April 12th. So it's 2 weeks later.
March
3/24. And then if we follow the same schedule, it will be June 16th. Right now, school is due to end on the 15th, but with the snow day, it's now the 16th. I'm sure we'll have another one before then, so why don't we just tentatively schedule it for the 16th, and if we have school, I'm the only person who has a kid in public schools anymore, so I can't imagine it's going to be a problem, but we'll do that. And then moving forward, it's September 15th. I already know I cannot be there. If anybody cares.
We don't. No.
Which is totally fine. You can go ahead, or we can do the week before, which is the Tuesday after Labor Day. Usually everybody's around then anyway. Mm-hmm. Is that okay? Mm-hmm. So we say 9/8 for September, and then this December meeting will be the 15th, which is again the third Tuesday of December. Everybody cool? And we'll circulate these dates.
September 8th.
May I ask if the time can be made earlier? It's 7 o'clock now, and there's been circumstances in my life that have changed, and I just wonder if we could make the meetings earlier than 7 o'clock.
What do you suggest? What would work?
I'm going to start with 5:30.
On a Tuesday, so far so good with me. I don't usually work on Tuesdays.
Fine with me.
5 p.m. Is that okay?
Yeah, I can do that.
Yeah.
That's terrific. Thank you.
Done. So we will schedule for 5 p.m. on March 24th, the 16th of June, the 8th of September, and the 15th of December. I will work
Just as long as you don't go to 5 till 8.
Yeah.
Don't worry.
The second order of business related to the schedules is, I think everybody, Jennifer, I talked to you, and I heard back from both of you about being reappointed for 2020. I did not hear back from you.
Sorry, missed that.
But I said you wanted to be reappointed anyway. Well, tough luck.
Okay.
Okay, so I resubmitted everybody to be reappointed for 2020, and I guess in March we will have again a vote for if anybody wants to take over for chair or be secretary. That is it. So, David, on to you.
Okay, thank you. Start off with our proposed budget for the upcoming fiscal year. We're really not asking for anything any different, maybe a few more hours for our public health nurse. But other than that, we're not initiating or instituting any new programs that would necessitate any financial impact on the town. One thing that I would like to do, and it's attached, is I'd like to make some adjustments to our fee schedule. If you look towards attached, there's a proposal. You know, we generally do pretty well with our food service facilities, but there are a few places in town that we repeatedly have issues with that fail multitude of times. So what I would like to do is to kind of ante up on the reinspection fees that we assess to those facilities that chronically fail. Now, the way we do this now is we have a reinspection fee for any facility that fails 2 or more inspections within a year. That's not January to December, but it's in, you know, if they fail in October, they fail twice until the next October, so they get assessed. No matter how many times they fail during the course of that year, they get assessed 50% of their permit fee. I'd like to increase that. So if they fail 3 times, it would be 75. My proposal would be 75% if they fail again, or it's 75% for the second reinspection and 100% for the third reinspection. That's 4 times extra we go into a facility. There are some places in town that will inspect as many as 8 times a year.
And that's time and resources.
It's
for
time
you.
and resources, and you know, and those are the official inspections. And facilities like that, actually, we go into them a lot more than just those official inspections, because we'll do kind of coaching, as it were, you know, to try to get these places to pass. But you know, there's just a few places, and they're only a handful, but they're repeat problems.
Are these class 4?
Yes.
Okay, so just working out the numbers then. 50% for first reinspection, right?
That's what it is
So-
now, no matter how many times.
Okay,
So essentially, it'll be escalating.
Yes.
And then if it's past 4, it's still 100%, right? It's
100%.
100%.
Well,
100%.
Yeah, 100%, and that really would represent in essence, a suspension of the permit, and they have to get a whole new permit.
Okay.
It would be a reissuance of the permit. I would have to do it, to have it be a permit suspension, I have to rewrite the regulations, and I really don't want to do that until the FDA food code comes into effect, because I don't want to have to go to the Board of Selectmen and redo, you know, regulations on a regular basis. They do have to approve any fee schedule changes, the board, but I wanted to run it past you folks first, see how you felt about that.
We had a similar thing with the RTM with false fire alarms, where they were hitting people up. It was just, I want to say it was $100, but now it's gradually going up, and we thought it was a deterrent. You know, for the same kind of thing, well, like this, you know, first offense, second offense, these aren't fines, but kind of similar.
Yeah,
did it work?
Well, we just put it in, but we think it's going to work.
it may not, I don't know, you know, honestly, you know, but our fees are high, you know, to begin with, and, you know, as I mentioned later on, I did do a comparison with comparable communities, and even though we haven't raised our fees in pretty much the whole time I've been here, we're still among the highest fee assessors in the state.
so class 4, just the numbers roughly, again, just for the math, you know, up to 8 times, that could be $4,000 or $5,000. $4,000. If it's a class 4
Yeah.
fee, right?
Yeah.
That's what we're saying. So
Yes.
100% for third inspection. So if it's 8, we know that's 5 right there. 5
Yes.
times. It's
And you know,
3,000 plus the other 3. That's 8. It's about over 4,000.
that would be incentive not to fail.
I would think so.
I would hope so.
I mean-
you know, the other thing that we've done, you know, to try to get, you know, those problem places is we'll require them to hire consultants to come in.
Right.
And I'm sure that's even more than that fee.
Right.
But we get to that point when we've reached that, you know, that threshold of saying, you know, there's nothing we seem to be able to do to get these places in line. So we require them to hire consultants at that point. But if we're also assessing those kinds of fees in addition to that, I think, again, that provides a little bit more teeth and incentive to what it is we're trying to do.
Most of these establishments are kind of individually owned or part of a chain.
Well, I guess it depends on what you mean by a chain, because there are places that may have 4 or 5 facilities in Connecticut,
Yeah.
or Connecticut and New York.
More like,
I'm not talking about a Chipotle, for example.
okay.
You know, but, you know, or, you know, as the chains up on the highway, so not something that big.
Got it. Okay. All right.
Okay, David, the only suggestion I would make is that failure to post a rating, like $50 is not funny. Make it 100. Make it, you know, $50. Does anybody agree?
Yeah, you know,
It is in code, right, that they need to do that.
Yep,
Make it 100.
okay.
For the posting?
Yes.
Okay.
We don't charge, we do submit ticks. I wanted to just mention, you know, there's some things that we don't charge for, and that's ticks for testing. We submitted over 150 so far this year. Radon test kits we also do for free. I'm sorry?
Sorry, just before you go on, the permit late fees.
Oh, yeah.
Kind of what's the, how often does that happen, and how
A
long
lot.
are they late?
A lot.
Okay.
You know, we'll have, again, it'll be some chronic folks that, you know, we give till, I think that this year we're giving to the 12th or something of January. And we can make multitude of phone calls to the places for some facilities.
Right.
So,
It's not that they don't know about it, it's just they're not doing it, right?
sometimes they blame other people or they misplace the application, you know, but still, I mean, multiple phone calls. It's like, all right, so we used to have a higher fee initially, and I tended to waive that more often than not. I think $100 is okay, but we need to increase it. The longer it goes, we should have them pay more.
Totally agree. And then the only other additional fee schedule proposal would be we've talked about this before, the water treatment, wastewater
Right.
disposal.
Right.
plan review.
And we don't get many of those, but that does not involve at this point any inspection work. It's just a review of the plan. So it's an in-office process.
And again, it's time and resources for you guys.
Yeah, and that's what that's about.
Okay. Okay.
Okay, so what I had done was I had spoken with Kate about getting on the Board of Selectmen agenda to propose these changes, but as I said, I wanted to vet it with you first, and so I'm going to be on the Selectmen agenda in January to discuss these proposed changes.
If you want me or one of us there, happy to be there.
I'll check with Kate and let you know,
Okay.
but I don't think that there'll be an issue with that.
How do the establishments get informed of a change like this? You know, is it just based on the news, or is there an opportunity where they learn about the new fee schedule? I mean, that could be a deterrent in itself, just knowing.
Well, this is a good time to do it because it would be done in conjunction with the issuance of their permits.
So they would see this as the
So
permits.
we already put in their notice, if they read these things, right?
Yeah.
There's a cover letter that goes with their permit application. And in that permit letter, I put in that I was requesting these fees. So they have been informed that this is in the works.
Okay, great.
And once it's approved, assuming that it does get approved, we'll send an email and notify places. And as I said, this doesn't apply to most of the facilities in the community. There's only a few, and I think we'll deliver that word by
Yeah.
directly. And I also wanted to mention again, I want to reiterate that the fee schedules for the health department, because I know that it's going to be a discussion when it's time for budget. Our fees are really, I think, pretty solidly ahead of, or at the very least on par with other communities. I checked with what I thought were comparable communities, New Canaan, Wilton, Trumbull, and Glastonbury, to see what they had as fees for things like septics and food service and so on. And just about across the board, the only one that is close to us is Wilton. The others, we are a little bit more pricey. So I think we're good. again, you know, we're holding the line on any increases, so we're not doing that.
Do food trucks enter into the equation at all? Or are they just because they come and go?
Well, we do issue permits to, that's an interesting kind of quirky thing. We have there's a couple different kinds of food trucks that we work with. One are the itinerant vendors that go around to construction sites that sell to the workers. Mm-hmm. Those are those self-contained trucks with the cabinets on the back. They bring in food from other locations, and so we do issue permits for those facilities. And we have, which is kind of, I think we're, again, the only jurisdiction that does this, we issue bumper stickers so that when one of those trucks go by us and we look, we can see if they have their permit just because they have a bumper sticker. And they do, you know. Then the other trucks are the high-end things that will go to special events, like at Wheat Beach events, and you know, there are these trucks that serve, you know, meals. And yeah, we do inspect those. Those are part of our temporary event permits. So we inspect them both, and they do pay. You know, they have an inspection fee, or permit fee. Legislature last year passed a bill that said that they wanted to, these food vendors were tired of going to have to get a permit from every jurisdiction that they worked in. So if they went to Norwalk, they had to get a permit. If they came to Stamford, they had to get a permit. From the Darien, they get a permit. So, you know, there was a law that was passed that said that the state health department and local health had to figure out a way to provide reciprocity for permits so that they would only have to get one permit from somewhere. And then, you know, it doesn't say we can't inspect them, you know, but we wouldn't be issuing permits when they came to town. I've been asked to serve on a committee to come up with some regulations to deal with that, to provide some uniformity to the approach, because some of these guys, you know, they'll have 15, 20 licenses and permits from different jurisdictions, and I agree, it's really cumbersome. There's nothing that says we can't charge an inspection fee, though. You know, again, covering our time, which is kind of how I think that we try to work it through. Does that answer your question? Mm-hmm. So, with respect to our staff, I want to give a shout out to Mindy Chambrelli, our sanitarian. Mindy has boundless desire to learn and excel. She's just recently been elected president of the Connecticut Environmental Health Association, which is a professional organization representing over 300 individuals from government and the private sector in the field of environmental health. It's quite an honor to her. I think it's also representative of Darien, you know, it's a representative of Darien. And I just want to acknowledge her professionalism and ability to work with others, because this really is an across-the-board kind of a position where she has to work with several different disciplines and different levels of government to be successful in that organization. And furthermore, her work in the statewide development of guidelines for cosmetology salons has been recognized to the extent where she gets calls from the health departments throughout the state. How do you do this, and what do you do about that? And she's also been selected to present at the 2020, I'll have the zero out there, 2020 National Environmental Health Association Annual Education Conference coming up. So, and the title of her presentation is, "It's More Than a Haircut." And truly it is. And that, you know, she gets into the nails aspect of the salons, and she's done a great job. Another item that's not listed here is that the town is going to do a trial run beginning in June for a 4-day work week. Monday through Thursday, late night of Tuesday. And going to run it for, I guess, from June 1 to September, end of September, see how it works. If the public is okay with it, we'll keep it. If there's a problem and if work isn't being done, or if there's expectations that aren't being met, we'll go back to the 5-day schedule.
So essentially, town hall would be closed on Friday?
Closed on Friday.
But we'll be able to get a dog permit Tuesday evening.
Pardon?
We'll be able to get like a dog permit
Oh, yeah,
Tuesday evening.
Yes,
Instead of taking time off work.
exactly.
Which is great.
Yeah, that's, the idea is it'll be open, I think, till a little at 7 o'clock
Okay.
on Tuesdays, which is one of the reasons why I thought ultimately if we had the meetings, you know, at that time it works within our schedules too, so I appreciate that. And Paul, our public health nurse, offers free blood pressure screening on Tuesdays and by appointment, and that's worked out well because there were some of our employees who really didn't realize they were having some blood pressure issues, and they've ended up falling under doctors and medical care. So that was good. And we did do, over the summer, we had a display booth at the farmer's market where she did the same thing, offered free blood pressure checks. And a lot of the merchants there, the farmers, took advantage of the free blood pressure checks. Food protection program. We're still good with our schedules, maintaining our inspection frequencies. In spite of a few problem spots, we had a facility that just opened a month ago. What we do is we give a 30-day permit for a new facility, at which time, you know, you give it a permit to open, and generally the place is perfect. You know, the equipment is new, it's all set up, but we have no idea of how the employees handle food or if they know how to handle food. So we issue a 30-day permit, during which time we evaluate the food handling practices of our the facility that's just opened. We had a place that opened recently that failed 2 consecutive inspections during that 30-day period. I did not renew their permit for another 30 days and suspended it, and they were closed over this past weekend, subject to in-house training. So that's a pretty good tool. That's been pretty effective for new facilities. I, again, figured that out a long time ago, that places may look good when they open, but that doesn't mean they know how to handle food and that the staff is trained in the procedures. So all permits expire at the end of December and are due January 1. So it's a big push for us right now to with the permit renewals. We're pretty consistent numerically with what we've been issuing over the past years. 146 applications were sent out this year. And again, we work with the tax collector and Public Works in that we will not issue permits to any facilities that are behind in their taxes or who have deficiencies in their grease recovery systems. Because if they do, then what they're going to be doing is creating sewer blockages, and we don't want that. So we have a list from Public Works right now, and we've informed them that, you know, unless they meet Public Works requirements for the record keeping and maintenance of their grease recovery systems, no permit. That's worked pretty effectively too. Then there's the old FDA food code adoption implementation situation where the state health department pushed really hard 3 years ago to adopt the FDA food code and told us that, you know, we had to do all this training and take all these extra courses in anticipation for the adoption of that and change our regulations. Well, it still hasn't gotten out of the Attorney General's office in Hartford, the regulations. It was delayed from July this past year, supposed to be implemented January 2020. There is no way.
That's in
2 weeks.
Yeah.
No way. They haven't even finished doing their inspection forms yet. We may see it 2021. They're not even talking about July anymore. And Connecticut is really the last state in the country to adopt the FDA food code. I'm sorry to say. I think part of the problem is what I've understood is that there are certain components of the proposal that the Restaurant Association in Connecticut are firmly set against. One being the requirement that all food service facilities register with the state health department before they can get a local permit. Fear being that registration would lead to a fee and state regulation of restaurants rather than local. So there's some concern about where that would ultimately end up. I don't know. But it's not going to happen. So I'm glad we didn't spend a lot of time revising our regulations the way lots of other jurisdictions in Connecticut did. Because they're still going, their state health department does a training program at Southern Connecticut for kids in school on food service and actually all components of environmental health. And they're going to be training people on the current code, not the FDA food code this spring, which is very disappointing. But moving on, unless you have any questions on food. Mosquitoes. It's an interesting year for mosquitoes and ticks. A lot of news on both. Every year we find West Nile positive mosquitoes in Darien. Every year we put out advisories about being, avoiding mosquito bites. This year was no different, although the first positive pool for West Nile mosquitoes wasn't found until September. And during the summer, there was quite a bit of news about EEE, Eastern Equine Encephalitis, particularly in the eastern part of the state. And it really got a lot of people concerned because of the fact that if you get sick from it, there can be some serious consequences. Most people don't get sick from it. Most people who are bit from the mosquitoes don't actually get sick, but those who do can be very severely ill, and there's a pretty high fatality rate, mortality rate associated with it. And in October, the way things work, we have department head meetings once a month, and at the department head meeting in October, I actually made a statement in the morning that, it was a cold day, and I made a statement, we don't have to worry about EEE. Well, later that afternoon, I got the phone call from the state health department that a positive EEE mosquito had indeed been found in Darien. It had been trapped a week before, but it takes a week for the testing to be complete and for us to get the results. That created, of course I contacted the superintendent of schools because the testing location that it was found was, of course, at the collection site near the high school, because we had two. One's at the high school, one's down near the beaches. So, and we had extensive consultation with the state health department about how we should handle that. And there were a lot of jurisdictions in Connecticut that kind of adjusted their schedules for sporting events and, just outdoor activities. And the constant advice we got from the state epidemiologist was, the risk is extremely low because it was caught a week ago, and we don't think there's any amplification occurring because mosquitoes aren't reproducing anymore. It had gotten too cold. But this had created its own concern amongst families in town, and I think that the superintendent made some decisions to curtail some activities and reschedule some things. We never recommended that they do it. We didn't think that it was necessary, but those decisions were theirs, and we discussed it with Jamie as well, and Jamie issued a statement that said that, you know, people need to make some decisions and think carefully about what they're going to do, and you know, follow the advisories of using best protection, and if you don't want to take the risk, then don't send your children to these events and don't go out to the evening events, which is reasonable advice. But there were the calls for spraying, and then there are those who say, if you spray, I'm going to sue. You know, so we'll see what happens next year. But the thought is, with the agricultural experiment station, that the EEE comes in waves, and it's not something that will be cumulative, so that it'll be greater next year and greater. And so we're hoping that's the case. But they have a very robust testing program for mosquitoes, so we'll know if there's going to be issues next year. They're very aggressive with their sampling program, the state is. Ticks. There's a lot of money in the tick program, in the mosquito program in Connecticut, not as much in ticks. And ticks are becoming more of a problem. And they're carrying more diseases, and there's more different kinds of ticks that we're finding that carry diseases than we did in the past. In the past, the only tick we had to worry about was really the deer tick. And numbers of deer ticks are increasing. The number or percentage of deer ticks that are positive with multitude potential illnesses is increasing, and we're also starting to see an increase in the Lone Star tick, and that's been also in the news. This is something that was really it was pretty much a southern issue, but they're moving further north with over the past few years. We're finding it more and more often. Any questions or thoughts about that? We'll probably be talking, I'm sure, more about this come next year. This issue of town policy in spraying. Other communities, both Norwalk and Stamford, do things like they treat the catch basins, but the numbers of mosquitoes and the numbers of positive mosquitoes really hasn't shown that makes a difference.
You mean that spraying makes a difference?
Yeah, I haven't seen that makes a difference. Mm-hmm. You know, we're in a coastal community. Every time it rains, you flush out the basins. Mm-hmm. So whatever's been put in the basin ends up out in the sound. Mm-hmm. You have to put stuff back in, you know, so they're good in times when the water stays in the same place, and that's when mosquitoes will breed, because it takes about a week for them to breed. But if it rains in between time, you know, whatever you put in there for, the larvicide doesn't stay. It's gone. So I never have been an advocate for that, and I haven't seen data that show that it really works, although there are those who claim otherwise. Reportable diseases and conditions. Of course, fall's number one reason for EMS calls. And we're making progress in working with EMS to tease out those calls that may have a substance misuse component to it. You know, we get a report of a fall, and what we're trying to do is figure out, well, is there alcohol associated with that, or is there, what else is going on? Is there something else? Our syndromic surveillance system, which is part of what we kind of get just numerical data that say why people are going to the hospital, show that emergency room visits for alcohol-related issues still exceed that associated with anything with drug overdoses.
And that's all age ranges, right? All age ranges?
It is.
It's not just,
It is. It's, you know, alcohol, you know, it's not just kids or binge drinking, it's all ages, you know, to seniors, from teens to seniors. With the highest prevalence being in the 30s. If I were to say, just generally speaking, looking at the numbers, those in the 30 to 40-year-old range tend to have the highest. And we're talking about emergency room admissions, so it's pretty serious stuff.
ER visits, not necessarily hospital admissions.
Right.
Okay.
Right. Last year, flu was the #1 reportable condition. Not STDs, but STDs weren't far behind. So last year, more people went to the doctors to be diagnosed and be tested and have those tests reported. As we've said before, tests, particularly for flu, tend to be woefully underreported, just like with Lyme, because a lot of those tests are just done in the office and, you know, they don't go to a lab. But for whatever reason, there were more people who had laboratory testing for flu last year, and it was it was our highest reported condition. And I think it had to do with when it was that they were going to their doctors, because flu last year tended to be late in the season, and I think it threw a lot of people off. Last few years, flu has been coming later and later.
Could it also be a function of the test, David, that it's easier to lab test these things on site now, and you can get an immediate result, whereas before, like if you came in with flu-like symptoms, they didn't test you, they just treated you for
Right.
flu, right?
Well, the only numbers we get are those that go through a lab.
Okay. All right.
So if the doctor tests in his office, that's not going through a
So
lab.
not those quick tests.
I'm not going to get that information. So the fact that I have that kind of number tells me that it probably was, God knows how much higher.
Yeah.
You know, significantly higher, because we're just I don't even know if we're getting the tip of the iceberg when we get the numbers we get for those reportables. Vaping. Vaping has been added to the list of mandated reportable conditions, with the hospital admissions for respiratory illness associated with vaping is now required by law by the state health department to be reported to local health. We've had 2 in town, 2 teenagers admitted to the hospital from respiratory response to vaping. Both of those cases, you know, in looking at the record, because they do provide us with information on these cases, acknowledge the fact that there was THC products, so they were vaping not some product made by commercial activity, but something that somebody concocted, which seems to be what the cause of these respiratory illnesses is from, not so much the legal products. But CADH, our Directors of Health Committee on Substance Use, will be also looking again to reactivate the idea of having overdoses added to the list of reportables, because it's kind of hard to say, you know, vaping can be reportable, but overdoses aren't. So we still don't know when there's an overdose. You know, we don't know who it is, when it is, how, you know, so there's no proactive or preventative measures we can take for overdoses. Kind of ran the 2 together with substance use and vaping. As I said, if respiratory illnesses associated with vaping has been added to the list of conditions reportable to local health departments. we have, and they're both teenagers, so we have been in discussion with the superintendent of schools on that matter. I've been contacted by some parents who want to know what programs we've initiated or instituted for dealing with this problem of vaping. And of course, we had a presentation at the library in October that was, not well attended at all. Was recorded on Vimeo, so it's available through our website now and on Vimeo. I thought it was an excellent presentation. We had a pulmonologist there, we had a pediatrician, and our James Palmieri from our Student Resource Officer speak about vaping and brought in some examples of the things that kids are using.
Of the people who were there more adults or were there kids there? Because it looks like you wanted to have both.
The idea was to have both. There were a couple of families, maybe 3, that brought kids, and there were a couple of kids who asked a bunch of questions. So, the feeling is that as frustrating as it is to put all the effort together and have people, experts come in and, do presentations, take time out of their schedule to do these things, to not have a great response to it is disappointing. But if we can reach a few people, then that's good. And again, Channel 79 does a great job with recording and reporting on these things. And this particular Vimeo is really good because they've taken the PowerPoint presentation and embedded it with the presentation, verbal presentation, so it's really very well done.
Is there a way to get that, through the Board of Education, get it into the classrooms at the school, that presentation in their health education?
Well, I keep trying to talk with, the superintendent of schools would be the person.
Yeah, well,
to go
he's
through.
new, so maybe that would be great.
I met with him.
Yeah, you did, okay.
I met with him about a couple issues. We spoke about vaping, we talked about EEE, and we also had some discussions about measles and immunization rates.
We'll say, if you go to high school, before you do any activity, whether it be sports or extracurricular, you have to, in August, go to a vaping session. And Brian Long, who's the new replaced
That's with
detective.
sports.
There was a ton of, they literally filled, and this is one of 2, they filled that auditorium twice, and they did a really good job. They have a physician there, Ellen Dunn was there, they have an addiction specialist there. They do a really good job.
And we should also start thinking about the middle school. Only because I don't know about Darien, but the school that I work in, we have children in the 5th grade who have been vaping, and I told them about the Vimeo, the presentation here, and I think one child was frightened enough that he hasn't done it again. So,
that's great.
but we have to get them earlier.
You do,
Yeah.
we do, and it's there. It's a resource that's there. That's the good thing about it. So we did the work, and it's as I said, it's on our website, so it will always be there as a resource. And to get the schools to actually promote it and have it be on their website, or if they have a resource page for that. Again, I've had several discussions with Dr. Adley about trying to do some cooperative ventures on this, and he's certainly receptive to it. Now, we just have to make it happen. Also wanted to give a shout out to some of the work that the Directors of Health Association has done. There's a lot of resources in Connecticut on responding to the opioid crisis, and there's no centralized place to get that information, or hasn't been. It's scattered all over the place. Different communities have done different programs, and there's all these different initiatives. We, in conjunction with the State Health Department Injury Prevention Program of the State Health Department, Yale School of Public Health, Connecticut Public Health Nurses, Connecticut Association of Public Health Nurses, had, in working had just found this great resource in Massachusetts that the Massachusetts Health Officers Association had put together on addressing the opioid crisis in Massachusetts. And we took what they had, because they invented the wheel. They were the first ones in the country to do this, to actually provide for a toolkit for local health officials in responding to the opioid crisis. It's applicable across the board to any community. So if we realize that we have situations here, it's a great resource kit that all health departments in Connecticut can use, because it's Connecticut specific, with really a tremendous amount of work done by Yale School of Public Health continuing education program to pull together all the resources that there are in Connecticut. It's a huge website, and it can be found on cadh.org.
CADH.
CADH, that's short for Connecticut Association of Directors of Health.org. It's the opiate toolkit. I'm very proud of being involved with the development of that. Hopefully, it was just unveiled last week, so it's brand new. And not finally, but flu prevention program, we're kind of chugging along, same as last year, getting out our flu shots. 273 this year versus 270 for last year, so that's right there. We've had 4 clinics, and we've had great success with our online scheduler. Our nurse is here 2 days a week for 5 hours a day, and she's done over 80 vaccinations through that time. It's an online scheduler, and it works out pretty well.
Any predictions for this year? Is it expected to be a bad year for flu, or is it too early to tell? I mean, have there been any cases yet?
Yes, there's been a couple fatalities, 2 or 3. We certainly urge, it's not too late to get flu shots. Flu activity has not peaked yet, so you can still get your flu shots through us. We still have vaccine left. So if anybody's interested, again, through our website, you can schedule an appointment. It's not too late. Because as I said, last few years, the flu rates seem to increase. We're still seeing flu in April, which is really unusual in years past.
This year has been coming early. It's taking people off guard. That flu, there's been like you say, a few deaths. And I was up at Yale last week, and a lot of people who were staff were wearing masks because they had not been vaccinated, and so the policies that they had to wear a mask. And then the doctor said that there were some cases up at Yale now with people with the flu. It's come earlier this year than expected, because usually, they would, flu vaccines were given a little bit later, a lot, because they were trying to hit the peak, and later in the winter, the spring, but it kind of taking people off guard right now. So, and they said that they don't really know how that's going to pan out, if it's going to be really severe or not. It was just too early to tell.
It's a roll of the dice.
Yeah.
Even the formulations that they use for the vaccine, it's a roll of the dice.
Right.
They look at this in March, trying to figure out what's going to happen, in the fall, based on what's going on in the southern hemisphere. Try to extrapolate.
And I heard this year they expected to hit the people in their 30s a little bit harder than in other years. It's kind of the demographic right now, it looks like.
So, again, we still have vaccines, so come and see us. The last thing I wanted to mention was, again, we are partnering with the State Health Department to offer free radon test kits, and we encourage everyone, even if you've tested your home before, there's nothing wrong with testing again. It's free, and you don't know if you have radon in your house unless you test. Can't see it, can't smell it. Especially important if you live and have your home close to ledge, or if you spend a lot of time in the lower levels in the basement of your home, because that's where the radon levels tend to be the highest. So if you live in your lower level and you're shallow to bedrock, we strongly encourage you to test your home for radon.
What is the test entail, David? Is it?
Oh, it's just a matter of putting a little filter media out. It comes in a little pouch. You put it out in that lower area of your home and let it sit there for, I think it's 48 hours.
Mhm.
Put it back in an envelope and you mail it. So it's very passive, it's very simple. It's not complicated at all. And I think it's all postage paid.
And do the results come back just to the homeowner, or are they shared with the town?
The results go to the homeowner, it goes to the state, and interestingly enough, we have to request it from the state. We don't get it automatically. But we want to have it because we want to know if there are areas in town that we need to be concerned about. We've been pretty fortunate. I haven't found that there's any particular hot spots other than a relatively newer, and I'll go on record as saying this, a relatively newer condominium project up near Stamford, where we've had 4 or 5 cases of elevated radon levels in the newer condos. So we do recommend that everyone there get tested for the radon.
And how, I know, I guess it's mandated that you mitigate it if you do have radon.
No, it's not mandated.
I thought they had to if they get reported.
No.
And then it's
We
gonna-
tell you that you have radon, elevated radon, and we recommend that you do it, that you abate it, but you don't have to.
Oh, I thought they had to, and then.
Well, it's your
what would-
private property, we
Yeah.
can't make you do it.
Yeah, what would be the cost to do that for?
My understanding is most radon mitigation efforts are $1,500 to $2,000. So it's not terribly expensive, because really what you do is you vent the subfloor of the basement.
Right, right.
So you basically cut a hole in the basement and put an exhaust fan through the roof. It's got to be through the roof, can't be through the wall, because you don't want to be walking outside next to where the vent is off gassing. So, but it's not terribly expensive, and it's very effective. And the only way to know if you have radon is to test. So we strongly encourage testing for radon. If you haven't done it before, do it now. And that's my report
Just stay out of the basement.
for tonight.
Pretty quick thing. So, just thinking back, as far as my records go, I started doing this in 2004, so 2019 would be 15 years of doing this, and just to see where we started from part-time health director, part-time department, part-time sanitarians to where we are now is just truly incredible. I mean, it's amazing and a testament to all the work that you've done. So thank you.
Well, thank you.
To thank you guys for taking your time out and putting a lot of thought and effort into these meetings. I appreciate it, and happy holidays.
Along those lines, yesterday I was asked, isn't there ever any turnover in the advisory board of health because this person's been watching because they want to get on the board? And I said, no, there hasn't been. I mean, it's been a great board to work with, and you know, I appreciate you folks and the work that you've done and the fact that you're here, and the support from you all. But truth is that, you know, the answer to that question is no, there hasn't been any real turnover here. And again, I want to thank you too. I wish you happy holidays.
Happy holidays to you.
Thank you. Happy holidays.
See everybody on, if not before then, on Tuesday, the 24th of March at 5 p.m.
5 p.m. Thank you for that too.